Ya. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning. First of all, I would like to say thank you to organizing committee 12 Malaysia Indonesia Brunei Medical Science Conference 2022 from University Brunei Darussalam. Okay, this morning I will talk about the international collaborations in health infrastructures during COVID-19 pandemic. Before we start to talk about this matter, I will give you the information about the what is the develop of about the industrial evolutions in the world. First, start from end of 18th century, what we call it the industrial revolutions, and then next about the beginning of 20th century, international revolutions through the introductions of divisions of labor and mass productions of wheat, the help of electrical energy, and start from the beginning of 17, what we call that industry 3.0, through the use of electronic and IT further progressions in autonomous productions. And today we are in the industry 4.0 with based on cyber physical systems. Okay, so now we are in what we call the current conditions of healthcare in disruptive era. The problem is there is so many hoax, and then everybody using gadget, and then most people go to the consumerisms. Advance in technology with growth at such tremendous rate in this era absolutely also bring a positive impact to the field of medicine that we call digital transformations in healthcare. Okay, you know that the digital transformation of healthcare consists of AI, artificial intelligence using robots, virtual health assistant, digital imaging, and many more. And the second thing is big data aggregations, collecting demographic informations, the basis of unlimited clinical research. And the third is the communication technology, the most simple but very big impact, especially in the field of medical education. Okay, yes, this is one of examples of using equipment as a diagnosis of the GI problems using the endocapsule. This is using the digital transformations with the high-tech medical record. And other things is about the personalized medicine and then artificial intelligence in medicine. Okay, what is the effect of the digital transformation on collaborations? You know that they will open many ways for the new collaborations between you to you, university and university, and also university and government. And the important things, they will be sharing resources to achieve a better outcome. Yes, this is the current concept of collaborations here in our institutions about the triple helix. Triple helix consists of academia, government, and industry. And for pentahelix, beside this triple helix, there is a community and also media. I think this is a good things in this era to make a concept of, or to use the concept of pentahelix. Okay, this is one of examples that the using of artificial intelligence, what we call that the triage for COVID-19 using artificial intelligence on chest X-ray to develop what we call that CAT for COVID, indicating the extent of COVID-19 related abnormalities, such as lung abnormalities, the heat map and the quantity of percentage of lung that is effective. Okay, so we are here in University of Indonesia. We have what we call that the Indonesian's Medical Education and Research Institute. Consists of neonatally sustained baby, bioimaging system for animals, laser micro dissection, adult integrity simulation patient with accessories, and this is the building. So actually, in this new building, we have two towers: tower for medical education, and then another tower for research towers for research. Okay, this is some activity of us. First, the six open innovations, and also we have a international conference that we call it Eyes on Emery. And for this year's, the topics of this year is the biomolecular research. Welcome back to the future biomedical sciences. Many scientists from national, international participate in this event. Okay, now we will talk about the Faculty of Medicine and research collaborations. Faculty of Medicine always tries to develop ourselves in the field of medical and health profession educations, mainly by increasing its international collaborations in many ways as possible. Some like doing a joint project research training center, inviting guest lecture from all over the world, and then actively sending their students abroad. This is the way to increase our international collaborations. Okay, how about the collaboration in pandemic era? Pains of these conditions, limited of direct contact with people, movement and travel restrictions, necessary change in active lifestyles, and then the pandemic response and financial planning consume strategic efforts. What about the gains of this pandemic era? You know that the virtual communicating experience digital campus. It is common now to make an online Zoom meeting, and then the collaborations move online, a project grows. Knowledge sharing and spreading is easier, as you, yes, about the gains of the gadget in the pandemic era, and pandemic as an accelerant for digital transformation in the health sector. Okay, this is another examples that we make what we call it to invite international guest lecture. For this session, we invite Professor Haddad to talk about the updates of global nutrition and food system, action to accelerate the progress on nutritional and health lesson learned from Indonesia. And we have a programs that we call that the 14th Jakarta meeting on medical education. Okay, yes, this is another conference that invite national and international speakers from from one of our department. Okay, beside to invite international speakers, so we have also what we call that the international collaboration for student exchange. Before pandemics, we are working together with the NUS, Kobe University, Leiden University Medical Center, Maastricht University for student exchange, and Osaka University for 1 or 2 PhD scholarship, and for Erasmus University Integrated Elective Minor Global Health 2011. And with the University of Scuba, we have student exchange programs, and also Central Queensland University, University of Sydney, and Nopan Rajatani Hospital, National University of Singapore, and also Fries University Medical Center of Netherlands, that we have programs that we say that student exchange. Okay, besides that, informal we have what we call the double degree programs that the student get medical doctor from us, and then get Bachelor of Science from Monash or Melbourne, and Master of Research for Newcastle University. This is a 1-year study programs for Faculty of Medicine international program student. Okay, actually we also have double degree programs for specialists, and also the student who take these programs can take Master of Clinical Research from University of Melbourne. Okay, this is the situation during pandemic before that we also produce the ventilators. Actually, the expert from us and our friends from engineer to develop this product. Okay, yes, I mentioned that we have many international collaborations. One of them is with Leiden University. Until now, we have 30 around 30 years of collaborations, and then produce many prestigious paper in the famous journal. Here you can see that this is our student take a photo with their supervisor and also rector. Here one of the publication to talk about the effect of anti-helmintic treatment on serum-free IGF-1 and IGF-BP3 as a cluster randomized control trial in Indonesia. Also with the Oxford, we have 10 years collaborations, and then we have one lab that in this lab we are working together with their expert. Okay, this is some publications from us over the malaria, and also yes, about the COVID-19 as well, and also about the HIV. And this is another collaboration to support global, like in the recovery study, something like that. And yes, and also some other articles that we are working together with Oxford. Okay, in the groups, we have what we call that the Partnership in Research Indonesia and Melbourne. So not only UI, but we also working together with the Erlangga, Gajah Mada, and with the University of Melbourne under LPDP support. Okay, in the Asian countries, we have what we call that the Asian Medical School Networks. There is more than 20 countries participant in this network. Okay, this is the last time we meet offline in the University Brunei Darussalam at the time, the 8th Asian Medical Dean Summit. And also we have working together with the China consortium before pandemic, that at the time we launching China ASEAN consortium. Okay, and then starting July 2018, Faculty of Medicine plus Indonesia was chosen as a regional office. So the Dean of Faculty of Medicine to be an ambassador, regional ambassador for these organizations that base then the base of this organization in Washington DC. Okay, this is some of our activity as a regional webinars. Okay, and then with the many kind of topics like these topics about the COVID-19 and other topics about the medical education. Okay, and during pandemic, so we still have what we call that the Association Academic Health Center Southeast Asia webinar. So there is some expert from abroad to give their lectures to us, and the participant not only our members but also others person who interested in medical education. So this is the locations of our international publications with the with our institutions in Asia Pacific, Middle East, Africa, South America, North America, and also Europe. So our frequent collaborations is mainly within Asia Pacific and Europe. Ladies and gentlemen, Mr. Chairman, so the conclusions of my talk is in digital transformation era, collaboration is the key for medical institutions to face a constantly changing medical education system. Collaboration can facilitate capacity building, which can improve the quality of medical education, research, and innovations. COVID-19 pandemics will be accelerator in maintaining the collaborations in digital transformation era. Faculty of Medicine such Indonesia is very eager to have a partner in international collaborations. Thank you for your attention. Wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.